We've had what I refer to as a very fruitful discussion on progress.
There is absolutely no particular matter that you agreed on.
Doctors have reiterated that their strike, which began last Thursday, remains ongoing until all their demands are met.
Good morning.
Despite holding a meeting with the Ministry of Health to try and find a way forward, the disagreement between doctors and Health Cabinet Secretary Susan Nakhumicha continues to deepen, and patients may soon suffer at hospitals.
The strike is on, and it will get a little bit tedious repeating the same thing because we are in this for a very long time. We intend this to be the last strike of a decade.
KMPDU Secretary General Dr. Davji Atela claimed the union has in the past held meetings with the government, but the commitments arrived at had never been implemented.
We have agreed that they are going to participate in the review of the internship policy. We ensure that it is aligned to universal health coverage.
The CBA 2017 actually give terms to which interns should be posted, and that's what we stand with.
Nakhumicha says the National Treasury has committed to meeting the 4.9 billion shilling budget required by the Ministry of Health to post medical interns.
We don't need promises, we need solutions, we need results, we need outcomes.
Davji says issues such as the posting of interns had lingered on for long, adding that despite previous promises to post the interns, nothing has been done to date. Doctors have cited implementation of the 2017 CBA as an non-negotiable when it comes to calling off the strike.
We have agreed that within this week, the ministry then calls for a meeting so that then matters that are in the CBA can be addressed and negotiations begin.
We've had commitments before with government, both in the national and on county governments in the month of January 2023, but nothing to date has been implemented.
Despite assurances from Nakhumicha regarding the doctors' demands, KMPDU remains steadfast, emphasizing the Ministry of Health's responsibility in resolving these issues.
There are matters that are to do with the Ministry of Education, matters that are to do with the Council of Governors, matters that are to do with public service.
Doctors belong to the Ministry of Health.
The Ministry of Labour has scheduled a meeting on Tuesday in an effort to resolve the issues raised by striking doctors. If the Ministry of Health and Doctors Union fail to reach an understanding soon, Kenya may be staring at a health crisis where patients totally lack services at hospitals. Ben Kirera, K24, Nairobi.